Thank you, Senator Robson. Up next, we're going to be hearing from people I'm afraid that Paul Ryan never took the time to listen to. We have got the Wisconsin Physicians for National Health Care up next.
We represent the Wisconsin chapter for Physicians for a National Health Program. We advocate for a single payer healthcare system. Medicare for all. Our slogan is everybody in, nobody out. Up with me are fellow physicians and medical students. As healthcare professionals, we strongly oppose the Republicans' healthcare plan. The ACA wasn't perfect, but it was a big step forward. It did expand coverage to millions across the United States. I practiced in Belleville, Wisconsin for 25 years. And I saw firsthand the people this helped. I saw farming families that didn't have to take on a second job just to get health care. I saw people that had pre-existing conditions that could finally afford health care. I saw people who had their health care coverage cut off because they got sick. They were able to get health care again. These are the people that the ACA has helped the most. Costs are still too high for many, but society benefits when we treat healthcare as a human right and include all. Everybody in, nobody out. Unfortunately, instead of providing solutions to improve the quality and cost of care and to ensure everyone gets basic health care, the current bill solves none of the problems we currently face, and it creates some dangerous new ones. It would be a big step backwards. It would take us back to the bad old days before the Affordable Care Act, when tens of millions were unable to afford even basic health care coverage or had bare bones policy. It would destabilize our already fragile health insurance payment system and end up taking away health insurance from millions of Americans. The bill preserves a private health insurance system that has been a proven failure now for over 50 years. It would continue to allow insurance companies to limit choices through networks and shifts more cost to patients. Despite the rhetoric, the Republican bill would not return decision-making to patients or doctors, but would keep insurance companies in control. Let's not forget, their purpose is to make a profit, not deliver health care. Speaker Ryan said that passing the bill would be an act of mercy. Speaker Ryan, I have a much different definition of mercy, along with Representative Kennedy. My definition does not include taking away health care from millions of our most vulnerable Americans and giving tax breaks to the rich.
Right.
This bill would radically change Medicaid from a safety net for the most vulnerable, those living in poverty, the disabled, children, and the elderly, to a program that puts a price on the heads of the poor. Right now, almost half of the cost of childbirth and long-term care in our country is paid by Medicaid. These are the people who will suffer the most when cutbacks are forced to the states. There is a better way forward. We can expand and improve Medicare for all. As healthcare professionals, as physicians, we take an oath to do no harm. We call on our representatives and we call on Speaker Ryan as they vote on changes to our healthcare system to do the same. We can't go backward on healthcare reform. We need to move forward to a system where everybody is in and nobody is out. The lives of our patients depend on it.
Everybody in, nobody out. 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 All right, now for the most important speakers of the day. That's you guys.
Yeah!
You, the constituents, the people that Paul Ryan should prioritize. First up, we have Sharon